chance to read, or my studies to read, I read them. It's my computer, I read I sit and read the CT scan. As a resident, we're a group of residents, we're about 35 residents in total, so about 8 per year. We help each other, especially the seniors, they help the juniors, first of all, deal with the calls, so stressful situations, to make them prepared to take the calls and be comfortable on call. Even doing later on, when we're a staff, there's a lot of times or cases we're not sure of our decision. We can consult our colleagues. It's very helpful to have people beside which are open to help. And that's very important in radiology. Although it's predominantly individual work, you have to be a good team member because it's helpful. You will need help, and you may help somebody else. Stress level I talked about, and the satisfaction I'll talk about the advantages. So that's, as a radiology resident, as a staff, it's important that there is no big change in our lifestyle and their lifestyle, except for the calls. And that's important when you, first of all, when you go into medicine, you'll choose your specialty. But when you choose your specialty, it's important to know what's your life as a staff later on. There's no point to say, oh, I look at these residents, I like their lifestyle. But if you don't like 20 years ago, what the staff in that specialty is doing, you may be wrong. So you really have to look forward and see what's the lifestyle of the staff, what the staff radiologist or surgeon does usually during a day to determine what's your field. And in radiology, basically every day I do the same job as my staff. Although once I read my scan, the staff has to just eyeball it and say it's fine, and you can dictate it or sign the report. The difference is that when you are, every time I'm on call, there's a staff who's supervising me, theoretically, who is also on call, and that staff is usually at home. So when I'm on call at the Montreal General and stressing about these traumas that will come, he's at home watching TV, doing nothing. And he's on call, he's paid to be on call while doing and staying at home. When I'm on call on the weekend, my Saturday, I enter at 8, I leave the hospital at 8 on Sunday. He's on call on Saturday, he comes in the morning for 2 hours and leaves. And that's his on call on Sunday, or Saturday. It's that difference, and that's very nice because I'm looking forward to when I will be staff. My calls will be like that. So advantages and disadvantages. So I'm going to just spend a couple minutes of my time there. Many people will say, yeah, radiology, you do nothing. And if you do something, you'll do it in dark, silence, boring. And that's, unfortunately, that's what the majority of people think about radiology. And they'll say, yeah, you never see patients. Why did you go to medicine? It shouldn't be considered medicine. You never see a patient, which is wrong. First of all, not all of us like to see patients 24 hours per day. That's for sure not true. Even if somebody says, yeah, I like patients. You have to have your own time to relax. And radiology, I can see the patients if I want. I can see the patients every day. I can do ultrasounds every day in my working career, and I'll see patients every 5 minutes. I'll be interacting with them. I'm going to do ultrasounds. I don't know if some of you did have ultrasounds. You know that radiology is there doing, radiologist is there with you in the same room, speaking with you, asking you questions, and examining you. Basically, there is a patient doctor contact. If I don't like necessarily to see patients every day, I read the others. I read the scans, I read the x-rays, I don't see patients. For me, that's advantage. It's how I feel. If I feel to see more patients, I can do ultrasounds. If not, I can do, I can do biopsies. Again, there's a patient contact. I have to see the patient, speak with them, explain the procedure. If I don't feel like it, then I'll do something else. Calm environment, I like to be in calm environment. I don't like being stressed by other people doing procedures, or if I'm a surgeon, or anesthesiologist, or other professions. There might be always a stressful situation where people are running, they're crying around, or emergency. If you work in emergency as an emergency staff, it's never calm. For somebody, calm environment is a disadvantage. For me, it's an advantage. I like it. Responsibility level is high. Again, every field in medicine has a high responsibility level. Radiology is one of, for me, I think it's one of the higher levels. As I gave you the examples, why? Because many decisions are made upon our decisions. Advantages, so I said about interaction with the patients, interaction with the peers. They probably, and it's debatable, but I believe so. When I'm on call, I'm probably the person the most paged in the hospital. We've talked, when I'm on call, I speak with the emergency doctor, I speak with the surgery resident, I speak with the urology resident, I can speak with the orthopedic resident, I can speak with the internal medicine resident. Basically, I can speak with anybody in the hospital because they all sometimes, they all need some type of imaging, and they will ask me either to approve it, to read it, to give my opinion or anything else. So we do a lot. We deal basically with every field of department in the hospital on a daily basis, which I like. Challenges, it's challenging. Every scan or X-ray which I read, I find it as the enigma, which I'm trying to resolve. I'm trying to find where is the abnormality. Is anything abnormal? And if I find the abnormality, what is the abnormality? So I have to find all the clues to help me to find the solution. Knowledge, probably together with pathology, it is believed that radiology is the field that we have to read the most. Basically, I have to know every possible disease presentation from the scalp all the way to the big toe, involving every part of the body, because I have to know if there is abnormality in the humerus, in the arm, or in the finger. If the bone is abnormal, I have to give some intelligent answer to the family medicine or to orthopedist what that abnormality might be. Sometimes, and more often than not, we are the one who first suggests some disease just accidentally found on the either ultrasound or X-ray. Great amount of knowledge. My days, as I said, are 8 to 5. However, I have to spend really reading 1 to 2 hours per day. I don't do it every day, but I should. Again, when I was looking at choosing the specialties, I said to myself, I would rather work 8 to 5 and read at home, cafes, wherever, for 3 more hours than spend my day in hospital from 8 to 7 p.m. Again, decision or fact to be aware when you're choosing your specialties. Again, lifestyle, it's a great advantage of radiology, which is not debatable. Very few specialties have the same advantage as us. Maybe dermatology for sure, ophthalmology, a couple of else, plus very few have the opportunity to go and work like regular working hours like other people. The future is bright. 15 years ago, we didn't have MRIs, CT scans. That was all barely coming to the field. Now it's a routine. In 10, 15 years, I can't even imagine what's going to happen as imaging. So shortly, do I enjoy my work? Yes, I would be here if I didn't. Would I like to change something? And I want to say something. When I chose medicine, I had no idea that I would be a radiologist soon. I didn't even know, as I said, first of all, about medicine, but about radiology at all. If you choose to go to medicine, I'm pretty sure each of you will find a field in medicine that's for you. It's so vast and variable. I have to be honest with you, during my med school, I didn't like every day of my med school. I would say 60% of my med school I didn't like, because I was doing things that I don't like. I would be in the surgery, helping the surgeon during the cardiac surgery, and I would have to help him hold the heart while he's doing something else. I didn't like that. I didn't want to do that for the rest of my life. Somebody didn't like it. And you have to be aware of that. And I'm pretty sure, even if it's completely different, you'll find something that you like in medicine. Again, I don't like